trigeminal nerve structure functions. Topical diagnosis in case of its defeat. So trigeminal nerve is the largest and one of the most complex cranial nerves. It's a kind of mixed nerve which have large sensory parts and much smaller motor part. Sensory components has three divisions: ophthalmic, maxillary, and mandibular. Motor and principal sensory nuclei: mid pons, spinal tract and nucleus, pain and temperature. So trigeminal nerve is, as I told you, it's a mixed type which has sensory and motor. The fibers are general somatic afferents carrying general sensation from face. The spatial visceral afferents supply muscles. The trigeminal nuclei have three: sensory plus one motor. The general somatic afferent, mesencephalic, midbrain, and pons receive proprioceptive fibers from face. Principal main sensory pons receive touch fibers from face. Spinal, pons, medulla, and upper two-thirds cervical segment of spinal cord receive pain and temperature sensation from face. The spatial visceral afferents, four muscles of mastication: temporalis, masseter, medial, and lateral pituitary. Other four muscles: anterior belly of the digastric, malleoid, tensor tympani, and tensor palati. So trigeminal ganglion, this site occupies a depression in the middle of cranial fossa. Importance: contains cell bodies whose dendrites carry sensation from face, whose axons from sensory roots of trigeminal nerve. So the trigeminal nerve emerges from the middle of the ventral surface of the pons by two roots: large lateral sensory root and small medial motor root. Divides into three divisions: dendrite of the trigeminal ganglion, ophthalmic, maxillary, mandibular. So axons of the cells of motor nuclei join only the mandibular division. Ophthalmic divides into three branches: frontal, lacrimal, and nasociliary, which pass through the superior orbital fissure to orbit. Frontal supplies skin of the face and scalp. Lacrimal supplies the skin of the face and lacrimal gland. Nasociliary supplies the skin of the face. So this is the sites. The maxillary, it supplies the upper teeth, gums, maxillary ear, sinus, posterior, middle, and anterior superior alveolar nerves. Face, zygomatic facial, zygomatic temporal, and infraorbital nerves. Mandibular mixed. So sensory branches: lingual, general sensation from anterior two-thirds the tongue, inferior alveolar, lower teeth, gum, and face. Buccal, face, cheek on the upper jaw. Auriculotemporal, auricle, temple, parotid glands, and TMJ. Motor branches to 8 muscles: 4 muscles of mastication and 4 at the other muscles, as you're able to see in the picture. So muscles of mastication: masseter, close the jaw, protrude it slightly. Temporalis, close the jaw, retract it slightly. Medial pterygoid, close the jaw and protrude it. Lateral pterygoid opens the jaw and protrude it. So unilateral pterygoid weakness, jaw deviates towards side of the weak muscle. So this is the defeat or the damage if happens to the trigeminal nerve. The compression, degeneration, or inflammation of the fifth cranial nerve may result in a condition called trigeminal neuralgia or tic douloureux. This condition is characterized by recurring episodes of intense stabbing, excruciating pain, radiating from angle of the jaw along a branch of the trigeminal nerve. Usually involves maxillary and mandibular nerve, rarely in the ophthalmic division. Thank you.